Annyeong!
Ni hao and hello.
Hello.
Welcome to episode 3 of Tea Time Med Chats. It's certainly been a while, but we've been looking forward to getting back into it. So today's episode is all about psychiatry. We would like to inform people before we start that during this video we do talk about very sensitive topics related to mental health, including self-harm and suicide. So Minji and I are just both coming off of our psychiatry rotations, so we're going to be offering our reflection on what it was like for us, and also providing just a short guide in terms of what to expect and what to get out of it.
I'm currently a fourth year med student, and I had my 4-week rotation at St. Vincent's Hospital, so that was mostly at the inpatient unit. And in MD3 last year, it's like a 5 or 6 week rotation, but that was exposure to multiple subspecialties like the inpatient unit or the consultation liaison or like clinics as well.
Yep, okay, so I'm currently an intern at the Alfred Hospital, so I just finished my 10-week psychiatry rotation, which was in the inpatient unit. So as a med student in MD3, I had my first exposure to psychiatry at the Wangaratta Northeastern inpatient unit, and then I chose to do my selective in my final year of medical school at Shepparton, and that was also the inpatient unit. And we should tell them about the tea as well.
Oh!
Yeah, we forgot about the tea. So today's tea that we're going to be sipping on is chamomile, orange, and honey blossom.
Oh, okay.
So it's really, really fancy. So if one of us falls asleep during the video, it's because of this one.
It says sleep well.
Yeah, it's sleep well.
It looks too hot. I'll have it later.
Okay.
Okay. So the first question that we have for ourselves is, when you were first exposed to psychiatry as a med student, what was it like?
So when I was first exposed to psychiatry in Wangaratta, I just remember thinking that it was like a completely different world, a whole new language, and I was like just really like overwhelmed by just how different it was to the rest of medicine and the rest of the hospital. Like there were just all these like acronyms and like things related to the mental state examination, like the Mental Health Act that I didn't understand. And it was just like really, really crazy seeing all the things that would happen like inside the inpatient unit. Like apples getting thrown around, just like people like singing and like people half naked. It was like just so crazy. And I just remember thinking like this would not be like tolerated on any other ward except in this hospital. It's just like so normal and like no one even cares. So yeah, it was really crazy for me.
Yeah, I think for me it was quite similar, where like other subspecialties such as going to clinics or consultation liaison, which is like visiting medically ill patients who also have like psychiatric illness, but their main hospital admission is for medical reason. So that was quite similar to other rotations, but then the inpatient unit, when I actually entered the ward, it was like a different vibe. When I first entered, I was quite intimidated and scared.
I remember when you were first in the inpatient unit, you said you really liked it and you found it really thrilling, and like someone nearly kicked your face.
Yeah.
And you were like so excited by that. That's what I remember you telling me.
I remember.
Yeah.
Because the patient was like trying to kick us as in like the doctors away from them. So we had to like, one of the interns was like, you should go hide in the bathroom quickly, and then, but I didn't. I kept watching.
Yeah, because you were too into it.
It was interesting.
Yeah, and I remember like so recently, because I'm on Gen Surge at the moment, like recently we saw a patient and then like this is a Gen Surge patient, and the Gen Surge patient told our fellow to like F off and was like calling her names and stuff, and she was like, I don't have to listen to this, and walked off. And then she was like, okay, so Richard, if a patient is ever rude to you, just remember you don't have to listen and you can just walk away. And I remember thinking, like, that's just not possible in psych.
No.
That's like every single patient, every single day. So yeah, that's basically what psych was like for me. It was just like craziness, like a new, and yeah, just a really steep learning curve for me.
It was really interesting to watch as a med student, because you don't really get to see that in like everyday life.
Yeah.
Okay.
So Minji, What did you enjoy the most out of your psychiatry rotation?
So for me, it was the inpatient unit because I did love like the adrenaline of like going into the ward and like not knowing what is going to happen.
Minji's got really thick skin, so she can handle a lot of stuff.
Are you gonna say I have a lot of fat or something?
No, it's not related.
Okay. Yeah, and then because it was like, because it's psychiatry, there aren't like that many patients in each team. I think it's, you look after like around like maximum, like for us it was like maximum 7 or something like that, like 6, 7. Sometimes even like 3, 2 patients. But because of that, you get to like really like look into the patient's records and really get to know them, and you're like listening to their stories, and you can also kind of like see them how they progress over time, because some of them are like admitted for a really long time,
like months sometimes.
Yeah.
I've seen people there for months.
Yeah. So you get to know them. It's quite interesting to see how they track over time.
Yeah, I think I like the same things as well. Is that you just like know the patient so thoroughly, and like the jobs, they're just like not as fast paced. Like the jobs, like you might only have like a few jobs per patient, but the jobs take a really long time.
Yeah.
Like taking collateral history, just like calling up their mom and like asking about like the pregnancy, asking about like the developmental history, like what primary school was like. It's like really like personal information, and you get to know people really well. And I also really like the longitudinal progression, and it's like really rewarding seeing sometimes like seeing someone come in like without much insight and like quite maybe like elevated or psychotic or something, and then seeing their recovery and just seeing them say like thank you and just seeing them well, I think makes me really happy.
That's nice. And yeah, because it's like not as fast paced as other rotations, I got to learn a lot as a med student. So I got to do a lot of like discharge summaries or writing down notes for a lot of patients, like doing MSCs, and that's really like helpful as well. And because it's like really like in like psychiatry notes, I feel like it's really important how you write things, and you have to think about like the connotation as well, like, of the words. It's not just like factual things. You have to think about what quotes you're going to use, like quotes of the patient.
I honestly think that note-taking thing is so real.
Yeah.
And I feel like my notes are like so much better having gone through psych.
Yeah.
Just like, because you have to capture every single nuance, because you don't know when it's going to get brought up in like an audit or some sort of like mental health tribunal. And like your mental state examination, otherwise known as the MSc, and like your notes actually get taken apart.
Because like I feel like search, like during your search ward round, you do the ward note, like you do the note like on the spot, right?
The notes are like lightning fast, and you like just submit like after you see the patient.
Wow.
And it's just like the like the history section is like that much, and then the on examination is like abdo, soft non-tender, like SFNT, heart sounds dual numb, SHSD, and then psych is just
it's so long, like it can be like 2 pages for each patient, like on a day.
Because they're like full on when the patient just like doesn't stop talking.
So yeah, when I got to like write notes like that, after like doing it, after attempting it once, and then the registrar or the intern would look over it and then give me like really, really detailed feedback, like in terms of like structure, in terms of like even just like word use. And then that was like really helpful, because I got to learn how to like write notes like more clearly, and yeah, that was really helpful.
So that's what you liked the most?
I don't know, I just went off topic. Okay.
That's what we call tangentiality, ladies and gentlemen.
Okay.
Let's keep going. Okay. Alright, so do you think in your 2 psychiatry rotations you've encountered a patient that you'll never forget?
Yeah, definitely. Because you get to like know them quite well. So like if you have a story and like you learn about their life, then it makes it quite difficult to forget about them. But then there was one specific patient who I could like link to more than other patients. She was of Korean background, like the same as me. She was the same age as my little brother. So I was like, thinking about what would happen if that was like my brother kind of thing. And then she had come in like after attempting a suicide. So it was really sad. And I got to see her mum and stuff, and like getting to see the whole family was like, like it got me thinking, what if my family had to like go through this, and yeah, it was just really sad thinking about them. What about you, Richard?
What about me? Well, for me, there's definitely like a few patients that I'll never forget, because like I totally know what you mean. You get to know them so intimately. The patient I'll never forget, I can remember someone who was like sort of my age as well, who was like a female with a diagnosis of borderline personality disorder, and she was basically like in the inpatient unit with an acute crisis, and she was like self-harming quite a lot, even on the wards, and she just had really strong suicidal ideations, and I don't think I've ever felt like so like helpless, I think, before in medicine.
That was a reflection on our rotations. Let's talk about what to get out of psychiatry rotations for med students.
Yeah, well, I think the first thing to understand is that there's quite a few different rotations available for med students. So there's the inpatient one, which I guess everyone like knows of. It's just like the mental health ward. But there's all these like community-based teams as well. There's like so many community-based teams, like the crisis and the treatment team. Like there's PARC, which is Prevention and Recovery Centre, I think. Like there's all these like rehab centres, addiction centres. There's so many different things, and all of them I would say are just as worthwhile as each other, because it's really good just to think about like all the supports and how all the systems are linked. That's like really invaluable. In terms of things to actually get out of your rotation though, I think one of the things is just like seeing how people talk to each other. Would you agree?
Yeah. You mean like doctors to patients?
Yeah, like doctors to patients, like how different team members communicate within the ward as well. Like the dynamic between like nurses and doctors, like OTs, social workers, like PTs, I'd say is like really invaluable. It's really good seeing consultants like interview patients. It's like really, really good. It's like their style and also the structure of their interviews. I think I'm always just like constantly like impressed by the way that they like structure things. Like for example, if like I want to ask if someone is experiencing auditory hallucinations, I'll like eventually get to it and I'll say, okay, and by the way, have you like heard any voices? Right? And it's like very like blunt, and it like does like tick something off the checklist. But like I've seen other consultants, they like ask a question like about like football or like their childhood or like their relationship with their father or something, and then like somehow they like just like build all the way up to like hearing voices, and it's like so masterful. It's like I don't even like notice it getting like slipped in. And it just makes me feel like, wow, I have like so much to learn and so much to improve on.
Yeah. And
so I think definitely be like really reflective after like each consultant patient interview, and just really think about how they talked. You know, were they really like gentle and soft and empathetic this time, or were they like a little bit more like stern and assertive this time, and like why different styles and, you know, different patients and how that all works. I think is a key thing to get up.
Yeah, it's really, yeah, I agree. It's just so like wonderful seeing like doctors like talk to patients and like use different styles in like for each different situation. Like I've seen some doctors be like, okay, let's take a moment, we'll just like breathe, we'll just like meditate for like a minute and then we'll keep going. And then when it was too like difficult, like we would have some, like the doctor also suggested, like whenever someone wanted to talk, we would have to like put our hands up, and that would mean that only that person can talk, so that it doesn't get out of hand. So there were like, all these like little like techniques and like that they would use, and it just worked so effectively.
It's so masterful. Yeah, I think another really good thing to get out of your psychiatry rotation is a solid understanding of your mental state examination. So I think before your rotation, it's good to like study up on the definitions of everything, so that you're not completely like lost when people are talking about like pressured speech or like. But then I think once you've learned those definitions and you get into the wards, like try and do your own mental state examination, like even when you're not the one typing notes, and then just like show your reg or show your consultant afterwards and just ask them for feedback.
Yeah, that's really helpful. And I think also before your rotation, it's also good to like know like the common conditions, like psychotic disorders or mood disorders. Like those would be like the basics. And I think having an understanding of what the DSM like criteria are would be really just helpful.
I think it's also good to like think about what sorts of conditions you're actually seeing in the wards, because I think when you're like in the GP setting, the kind of mental health disorders you're seeing will be quite different to what you're seeing in the inpatient setting. Like even if someone has like depression that's being managed by a GP versus depression that's managed in the inpatient setting, just think about the differences and like why someone is being managed where, I think is also good. Do you agree?
Yeah. Yeah. I think just in general, it's a really good rotation for you to learn like intern skills. Like I had lots of opportunities to call family members for collateral history, calling GPs as well, just like writing notes, discharge summaries, like all those little things. Yeah, it was just a really good experience, an opportunity to learn them and get heaps of feedback on.
That's a really good point. I agree with that for a few reasons. One is that psychiatry generally isn't a fast-paced rotation, so your consultant and a registrar like actually have a bit more time to sit down and give you the feedback. And the other reason I agree is because, like, let's not forget that psych patients also have like medical issues, you know? Like I've definitely charted like electrolytes for patients in the mental health ward. I've definitely taken chest pain histories, listened to things like ordered imaging and that sort of thing. And it's like such an underrated skill just in terms of managing like medical issues on the mental health ward, I think.
Yeah. And I also thought that just observing ECTs are pretty cool as well, because you can see the patients like getting a seizure, and yeah, it's just always cool to watch. And
like even the pre-ECT checkup, I don't know if you went to those.
No.
Like the post-ECT like review.
No, I just saw the ECT.
The ECT talk is pretty cool, to be fair. And it's also a good rotation just to brush up on your like medical knowledge as well, like in terms of like the pharmacology that people use, because you get like agitated patients like what, like every couple of hours, would you say?
Yeah.
And it's like, so thinking about the types of sedatives, the types of oral medication, the types of intramuscular medication is just like really invaluable. Okay, and lastly, I think is maybe like one of the more important things I think that med students should take away from their mental health rotation is just quite a lot of like introspection and reflection. I think is like really underrated. Just like when you see a patient who like frustrates you and is like just so annoying and or maybe scares you and is like yelling at you and telling you to like F off, calling you names and stuff, like how does that make you feel? Here's an example. So we had a patient who we didn't know had autism spectrum disorder, and our very first interaction was we just tried to get him into the interview room, and he was playing board games somewhere else and he just wouldn't come. And myself and my reg and the med student, we were just waiting in the interview room and the consultant was like trying to get him to come and he wouldn't come, and we like have jobs to do.
Yeah.
And we're just like waiting around doing nothing, and then people were like sort of getting frustrated saying like, oh my god, it's just a board game, can you like pack it up and that sort of thing. And like it wasn't until later that we like realized that he had a diagnosis of autism spectrum disorder.
Yeah.
And I think like looking back, that's the sort of thing that like I mean is like really valuable to like reflect on, just like your response to patients and how that influences your interaction and like your management. I think there's always the room for like empathy and patience, and like noticing like how that gets tested. I think is like really important, because everyone has like different triggers and gets tested in different ways, and it's pretty important, I think, to know that. And from then on, to be fair, we were like very like proactive. Like we would always like give him a pair of sunglasses to wear indoors. We would dim the lights when he came into the interview room. We would always give him a slip of paper telling him the exact time that we were going to talk to him, like the next day. So we would write like review such and such like 3 p.m. and then give it to him so he would know. Just that sort of thing I think is pretty important to see as well.
That's nice.
So in summary, I reckon the psych rotation is honestly such a great rotation. You learn so much, medical stuff, psych stuff, how to talk to patients, how to like communicate with multidisciplinary teams. I hope you get the most out of it as well. And as always, if you have any questions, please shoot us a message, leave a comment, and yeah, just hope you're enjoying med school.
Or your life if you're not in med school.
Yeah, alright. Enjoy your life, ladies and gentlemen.
Okay.
Alright,
That was
bye-bye.
really exclusive, Richard.
What? Okay, bye bye.